The following video will show you how to inject subcutaneous Rekovelle at home. Rekovelle is prescribed to stimulate the ovaries to produce follicles containing the oocytes. Before you begin, check against your KKIVF Center injection form to ensure that subcutaneous Rekovelle is ordered for the day. Do administer the medication at the same time each day. Then, practice proper hand hygiene by washing your hands with soap or use a hand sanitizer. Next, prepare the following items: 1 Rekovelle pre-filled pen, 1 single-use needle, 2 pieces of alcohol swab, 1 container for disposing the injection, such as disposable plastic bottles. Step 1. Set the dose. Remove the cap of the Rekovelle pen. Inspect the medication. Ensure the medication is clear with no particles and that it is not expired. Turn the dose setting knob until your prescribed dose appears in the dose feedback window. If you go past the dose you require, turn the dose setting knob backwards to the correct dose. Step 2. Attach the single-use needle. Clean the rubber inlay on the cartridge with an alcohol swab. Peel off the seal on the single-use needle. Attach the pen to the needle and screw the threaded tip of the pen clockwise into the needle until it is tight. Step 3. Remove the needle cap. Remove the outer needle cap by pulling it gently and keeping it for later. Then expose the needle by removing the inner shield. Step 4. Inspect the injection site. Inspect your skin to make sure there's no bruising, swelling, hardness, or irritation in the area of the injection. Step 5. Clean the injection site. Clean the selected site with an alcohol swab and let it dry thoroughly before the injection. Step 6. Administer the injection. The injection can be given anywhere 2 fingers below the navel. Use a different injection site each time to lessen the chance of damage to the tissues under the skin. Firmly pinch the skin with your thumb and index finger and hold it. Hold the injection pen with your dominant hand and ensure that your thumb can reach the injection button. Inject the needle into the pinched skin at a 90-degree angle and slowly push the injection button until the dosage marker reaches 0. Wait for 5 seconds. Step 7. Withdraw the needle. Lastly, place the outer needle cap into the needle and unscrew the needle by turning it anti-clockwise. And discard it into the disposal container. And use an alcohol swab to apply light pressure and gently wipe the injected site. Store the medication between 2 degrees Celsius and 8 degrees Celsius. Do not freeze it. Thank you for watching this video. We hope that it has been informative.